Hello, I'm Catriona Waitt and I'm a reader in Clinical Pharmacology at the University of Liverpool, and I spend most of my time in Uganda doing my Wellcome-funded research. For many years, regulators such as the FDA have recommended that clinical lactation studies are done around the time of drug licensing for any drug that's anticipated to be widely used in women of childbearing age. But the reality is far from the truth, and one reason is that in high-income countries, breastfeeding is seen as kind of optional. So often it is said to a woman, there are no data informing this situation, so the best and safest thing to do is to formula feed your baby. However, round the world, many women, including many of my own friends and neighbours, live in areas where formula feeding is neither affordable, feasible, acceptable, sustainable or safe. And these women have no choice but to take whatever medication they're prescribed whilst breastfeeding with no data to inform that decision. And for a long time there hasn't really been a voice of advocacy for these women. And even in high-income countries, the considerations of risk are somewhat simplistic because they assume that there are no risks to withholding breastfeeding. But the more we understand about the microbiome, immunology, psychosocial development, we see that there are vast benefits to both mother and infant through breastfeeding. And is it right to deprive a mother-infant pair of these simply because we haven't done the work? Now, thankfully, the tide is turning, and groups such as my own are seeking to engage with these populations to design and deliver high-quality, impactful research that informs evidence, and to engage with the right stakeholders to advance the research agenda. We still do have a long way to go, but with increasing understanding that there's a need for equity in terms of both access to research and to evidence-based treatment guides, the tide is turning.